Norma, did you hear the news about that soccer player that died? The news said that it was cardiac arrest, but based on his age, I wonder if he could have cardiomyopathy.
I thought the same thing. Maybe it was HCM, or hypertrophic cardiomyopathy, which is a genetic disease that is characterized predominantly by left ventricular hypertrophy in the absence of another cardiac, systemic, or metabolic disease capable of producing the magnitude of hypertrophy for which a disease causing sarcomere variant is identified, or the genetic etiology remain unresolved. However, the diagnosis of HCM can be sometimes delayed or misdiagnosed.
As a nurse practitioner, I don't want to misdiagnose someone or delay someone's diagnosis. What should I do to identify a patient that may be at risk?
You can refer the patient for a comprehensive workup because it will take an entire multidisciplinary team to treat the patient successfully.
I worked with genetic counselors before. What other multidisciplinary team members might be involved in the care of hypertrophic cardiomyopathy patients?
Cardiologists, preferably from an HCM center of excellence, or those who specialize in treating patients with HCM. You can also have genetic counselors, electrophysiologists, cardiac surgeon, or interventional cardiologist involved.
As a nurse practitioner or as a nurse just working on the floor, what else could I do to help my patient?
It is important to take every opportunity to teach the patient how to manage their symptoms daily. HCM is a different kind of heart failure. The mutant sarcomere genes trigger myocardial changes, leading to hypertrophy and fibrosis, which ultimately results in a small and stiff ventricle with impaired systolic and diastolic performance despite the preserved left ventricular ejection fraction. You can teach them about increasing fluid intake, taking their beta blockers, but more importantly, a shared decision making is recommended in developing a plan of care, including activity, lifestyle, and therapy choices.
Do you think an implanted cardiac defibrillator could have saved that soccer player's life?
Well, according to the 2020 AHA ACC guidelines, among referral-based cohorts of patients with HCM, 30 to 40% will experience adverse events, including sudden death events. Studies also reports that for patients who are at risk, the application of contemporary cardiovascular therapies and intervention have lowered HCM mortality rates to less than 1% per year. One of the major treatment initiatives responsible for lowering this mortality has been the evolution of sudden cardiac death risk stratification that can identify adult patients with HCM at greatest risk of sudden death, who are then candidates for implantable cardioverter defibrillator or ICD placement.
Wow, this has been really helpful. I feel much better prepared to treat my patients now. But where can I learn more?
PCNA has a lot of helpful resources online. Just go to www.pcna.net/HCM for more information about HCM.